Top 30 Dental Assistant Interview Questions and Answers. Are you preparing for a dental assistant interview? This video covers the top 30 most common and important questions, with clear, professional answers to help you impress and land the job. 1. Tell me about yourself and your background as a dental assistant. I am a certified dental assistant with 10 years of hands-on experience in general dentistry, pediatric care, and oral surgery. I graduated from University Dental Assisting Program, where I gained a solid foundation in chairside assistance, sterilization, radiography, and patient communication. I've worked in fast-paced clinics, supporting dentists with procedures and helping patients feel comfortable and informed. My strengths include strong organization, a calm demeanor, and attention to infection control protocols. I'm passionate about oral health and creating a positive experience for every patient who walks through the door. 2. Why did you choose to become a dental assistant? I chose to become a dental assistant because I've always been passionate about healthcare and helping others, and dentistry offers a unique combination of both. I enjoy working with my hands, supporting patients directly, and being part of a close-knit dental team. The role allows me to make a real difference in people's lives by promoting good oral hygiene and easing dental anxiety. It's also a dynamic career with continuous learning opportunities in procedures, technology, and patient care, which keeps me motivated and growing professionally. 3. What do you enjoy most about working in the dental field? What I enjoy most is the opportunity to interact with patients and contribute to their overall health and confidence. Whether it's calming a nervous child or assisting in a life-changing cosmetic procedure, I find great satisfaction in being part of their journey. I also enjoy the fast-paced environment, variety of procedures, and constant learning. Every day brings a new challenge, and I love working as part of a team that's dedicated to quality care. Knowing I've helped create a positive dental experience is what drives me. 4. What are your long-term career goals in dentistry? My long-term goal is to continue growing as a dental assistant while expanding my expertise in specialized fields like orthodontics or oral surgery. I'm also considering further education to become an expanded function dental assistant, EFDA, or even pursue dental hygiene. I'm committed to lifelong learning and hope to take on leadership roles within a dental practice, such as training new assistants or managing clinical operations. Ultimately, I aim to continue making a difference in patient care while advancing within the dental profession. 5. How do you handle a fast-paced or high-pressure environment? I stay calm, focused, and organized during high-pressure situations. I prioritize tasks based on urgency and maintain clear communication with my team to ensure nothing is overlooked. I've learned to stay one step ahead during procedures by preparing instruments and anticipating the dentist's needs. I also manage stress by keeping a positive mindset and focusing on solutions rather than problems. In past roles, I've handled back-to-back appointments, dental emergencies, and last-minute schedule changes effectively by staying adaptable and keeping the patient's experience at the center. 6. What dental procedures have you assisted with? I've assisted with a wide range of dental procedures, including routine cleanings, fillings, crowns, root canals, tooth extractions, and pediatric treatments. I'm experienced in preparing trays, taking impressions, suctioning, mixing materials, and providing post-op instructions. I've also supported dentists during emergency care, cosmetic procedures like veneers and whitening, and surgical setups. My hands-on experience has given me the ability to anticipate the dentist's needs and ensure smooth, efficient procedures. I always ensure that instruments are prepared, patients are informed, and the environment is clean and ready for every treatment. 7. Are you comfortable taking dental x-rays? Yes, I am very comfortable taking dental x-rays and have been trained and certified in radiography. I understand the importance of positioning, exposure settings, and safety protocols to protect both the patient and myself. I'm skilled in taking bite-wing, periapical, panoramic, and occlusal x-rays. I ensure proper shielding, explain the process clearly to patients, and minimize retakes by being precise. I always follow infection control and radiation safety guidelines. My ability to capture clear, diagnostic images helps the dentist make informed treatment decisions efficiently. 8. How do you sterilize and prepare instruments for use? I follow strict sterilization protocols to ensure all instruments are safe and clean before use. First, I rinse instruments to remove debris, then place them in an ultrasonic cleaner. After that, I dry and package them in sterilization pouches before loading them into the autoclave. Once sterilized, I label and store them properly. I also disinfect all surfaces in the operatory, replace barriers, and prepare trays based on the scheduled procedure. I always wear PPE and follow OSHA and CDC guidelines to maintain a safe and compliant work environment. 9. What dental software or scheduling systems have you used? I have experience using various dental software systems including Dentrix, EagleSoft, and Open Dental. I've used them for charting, appointment scheduling, billing, insurance verification, and patient records management. I'm comfortable entering treatment notes, processing digital x-rays, and updating medical histories within these platforms. I adapt quickly to new software and understand the importance of accuracy and confidentiality. My familiarity with digital tools helps streamline front desk and back office operations, contributing to a more efficient and well-organized dental practice. 10. How do you ensure patient comfort during procedures? I ensure patient comfort by creating a calm, reassuring environment and clearly explaining what to expect during the procedure. I check in regularly with the patient to make sure they're not experiencing pain or discomfort and adjust their position or provide a break if needed. I use gentle techniques when suctioning or assisting and offer emotional support, especially for anxious patients. Providing blankets, music, or simply a kind word goes a long way in putting patients at ease. My goal is to make every patient feel cared for and safe in the chair. 11. How do you handle anxious or fearful patients? I handle anxious patients by staying calm, patient, and empathetic. I start by listening to their concerns and reassuring them with clear, gentle communication. I explain each step of the procedure to reduce fear of the unknown and let them know they can raise their hand if they need a break. I use a soothing tone, make eye contact, and maintain a supportive presence throughout the visit. For children or very nervous patients, I may use distraction techniques or involve the dentist to reinforce comfort. My goal is to build trust and provide a stress-free experience. 12. Describe a time you had to deal with a difficult patient. Once, a patient was upset due to a long wait time and began raising their voice at the front desk. I calmly approached, acknowledged their frustration, and assured them we were doing our best to get them seen quickly. I offered water and kept them informed of the delay. By showing empathy and staying composed, I helped de-escalate the situation. After the appointment, the patient actually thanked us for our care. That experience reinforced the importance of listening, patience, and respectful communication when handling difficult situations. 13. How do you explain oral hygiene instructions to patients? I explain oral hygiene in simple, easy-to-follow language tailored to the patient's age and understanding. I demonstrate proper brushing and flossing techniques using models when needed, and highlight the importance of brushing twice daily and flossing once. I also provide tips on diet, fluoride use, and the impact of smoking or sugary foods on oral health. For kids, I make it fun and encouraging. For adults, I relate it to long-term health benefits. I ensure patients leave feeling confident and motivated to follow the routine for better oral hygiene. 14. How do you maintain patient confidentiality and HIPAA compliance? I strictly follow HIPAA guidelines by safeguarding all patient information, both verbal and digital. I never discuss patient details in public areas and ensure records are securely stored or accessed only by authorized personnel. I log out of computers when not in use, dispose of sensitive documents properly, and always verify patient identity before discussing treatment. During conversations, I maintain a low tone and conduct them in private when needed. Confidentiality is a cornerstone of trust in healthcare, and I treat it with the highest priority in every situation. 15. What steps do you take to manage infection control? I follow CDC and OSHA guidelines rigorously to maintain infection control. This includes using PPE, gloves, masks, goggles, sterilizing instruments after each use, disinfecting surfaces between patients, and practicing proper hand hygiene. I also regularly monitor the autoclave for proper functioning and stay updated on safety protocols. I dispose of sharps and biohazard materials in designated containers and ensure all operatory items are either disinfected or single-use. Infection control is essential for patient and staff safety, and I take every step seriously to prevent cross-contamination. 16. How do you handle conflicts with coworkers? I handle conflicts professionally by addressing the issue directly but respectfully. I listen to the other person's perspective without interrupting and try to find common ground. If needed, I suggest a private conversation to avoid disrupting the work environment. I focus on facts, not emotions, and always aim for a solution that maintains team harmony and patient care. In cases where resolution is difficult, I involve a supervisor or office manager for mediation. Open communication and mutual respect are key to maintaining a positive and productive workplace. 17. Describe a time you had to multitask in a clinical setting. During a busy morning, I was assisting with a root canal while managing the operatory turnover and helping the front desk with a scheduling issue. I prioritized by preparing instruments early, ensuring the patient was comfortable, and maintaining communication with the dentist throughout the procedure. Between steps, I sanitized rooms and relayed appointment updates to reception. It was a challenging but rewarding experience that tested my ability to stay calm, organized, and focused. I successfully supported both clinical and administrative needs, showing that multitasking is vital in a fast-paced dental practice. 18. How do you communicate with dentists during procedures? Communication with the dentist during procedures is key, and I use a combination of verbal cues and nonverbal signals to stay in sync. I stay attentive, anticipate the dentist's next move, and pass instruments efficiently without disrupting the flow. I confirm any unclear instructions respectfully and ensure everything needed is within reach. I also give updates about the patient's comfort or unexpected reactions discreetly. Clear, respectful, and timely communication ensures smooth procedures, minimizes errors, and enhances the patient experience. My goal is always to work as an effective extension of the dentist. 19. What would you do if you disagreed with a dentist's instruction? If I ever disagreed with a dentist's instruction, I would follow the direction in the moment unless it posed a clear safety or legal risk. After the procedure, I would privately and respectfully discuss my concerns, using facts and protocol to support my perspective. I believe professional disagreements should be handled calmly and constructively. My focus would always be on maintaining patient safety, clinical accuracy, and team collaboration. Open dialogue often leads to better understanding and improved practices, and I value mutual respect in any professional relationship. 20. How do you support front desk operations? I support front desk operations by helping with patient check-ins, scheduling appointments, verifying insurance, answering phone calls, and updating patient records in the system. I also assist in handling billing inquiries and preparing treatment plans when needed. My understanding of both clinical and administrative workflows allows me to bridge communication between the front and back office effectively. During slow clinical hours, I'm happy to step in at the front desk to ensure smooth daily operations and enhance the overall patient experience through efficient service and coordination. 21. What would you do if a patient fainted in the chair? If a patient fainted, I would remain calm and follow emergency protocols immediately. I'd stop the procedure, lay the chair back to improve blood flow to the brain, and monitor vital signs. I call for help if needed and notify the dentist right away. Once the patient regained consciousness, I'd provide reassurance, offer water, and document the incident thoroughly. If necessary, I'd recommend they seek further medical evaluation. I am trained in basic life support, BLS, and always prioritize patient safety and rapid response in emergency situations. 22. How do you stay updated on new dental technology or procedures? I stay updated by attending continuing education, CE courses, reading dental journals, and participating in online forums or webinars. I also follow reputable dental associations like the ADA for the latest guidelines and advancements. At work, I learn from experienced colleagues and dentists, and I'm always eager to be trained on new equipment or techniques. Staying current allows me to assist more effectively and support the practice's growth. I believe that lifelong learning is essential in a field as dynamic as dentistry, and I enjoy applying new knowledge to enhance patient care. 23. Tell me about a time you made a mistake. How did you fix it? Once, I mislabeled a set of X-rays under the wrong patient file. As soon as I realized the mistake, I reported it to the dentist and the front desk. I corrected the digital file, notified the patient, and documented the error for transparency. I then reviewed the process to ensure it wouldn't happen again and suggested we implement a double-check system for labeling. I take accountability seriously and view mistakes as learning opportunities. Addressing issues quickly and professionally helps maintain trust, patient safety, and the integrity of the dental practice. 24. How do you prioritize tasks during a busy day? I prioritize tasks by first addressing patient-related duties, such as setting up operatories and preparing for procedures. I use the daily schedule to anticipate needs and manage my time efficiently. If multiple tasks arise, I assess which are time-sensitive, such as sterilizing instruments or room turnover, and delegate when appropriate. I stay organized by keeping a checklist and maintaining open communication with my team to ensure nothing is overlooked. Flexibility and focus allow me to shift priorities quickly and keep the day running smoothly, even during unexpected changes. 25. Describe a successful team project or dental case you were part of. I was part of a team that completed a full mouth restoration for a patient with severe dental anxiety. It required collaboration across multiple visits with careful planning. I helped coordinate appointments, prepared materials, and ensured the patient was calm and informed. The dentist and I worked closely during complex procedures like crown placements and deep cleanings. Over time, the patient's trust grew, and the final result transformed both their smile and confidence. It was fulfilling to be part of a case that required teamwork, compassion, and technical skill to achieve life-changing results. 26. What is the correct procedure for mixing dental materials? The procedure depends on the specific material, but in general, I follow manufacturer guidelines precisely. For example, when mixing alginate for impressions, I measure water and powder accurately, mix quickly to a smooth consistency, and load the tray before it begins to set. For composite or cement materials, I use an auto-mix tip or spatula based on instructions, ensuring proper timing and consistency. I always wear gloves and prepare the materials in a clean, organized area. Proper mixing is essential for clinical success, so I approach it with precision and attention to detail. 27. Can you explain the difference between plaque and tartar? Plaque is a soft, sticky film made up of bacteria, food particles, and saliva that forms on teeth throughout the day. If not removed through regular brushing and flossing, plaque hardens into tartar, also called calculus, which is a yellow or brown deposit that strongly adheres to tooth surfaces. Tartar cannot be removed with brushing alone and requires professional cleaning by a dental professional. Both plaque and tartar contribute to gum disease and cavities, so preventing buildup is key to maintaining oral health. I educate patients on daily oral hygiene to control both. 28. What types of dental instruments do you commonly work with? I regularly work with a variety of dental instruments including mirrors, explorers, cotton pliers, scalers, curettes, suction tips, forceps, elevators, and handpieces. For restorative procedures, I prepare composite instruments, spatulas, and mixing pads. During extractions or surgeries, I handle surgical scissors, retractors, and suture materials. I also work with ultrasonic scalers and X-ray equipment. I'm meticulous about organizing, sterilizing, and preparing these tools to ensure efficiency and safety during procedures. Familiarity with instruments and anticipating what the dentist needs contributes to smoother treatments and improved patient care. 29. What's your understanding of OSHA and CDC guidelines in a dental office? OSHA, Occupational Safety and Health Administration, and CDC, Centers for Disease Control and Prevention, provide vital guidelines for safety in dental offices. OSHA focuses on workplace safety, including exposure control, PPE use, and proper labeling of hazardous materials. The The CDC emphasizes infection control practices, such as sterilization, hand hygiene, and standard precautions to prevent cross-contamination. I ensure compliance by following protocols, attending training, and maintaining documentation. Adhering to these standards protects both patients and staff, reduces the risk of disease transmission, and creates a safe clinical environment. 30. What precautions do you take when assisting during oral surgeries? During oral surgeries, I take several precautions to maintain a sterile field and ensure patient safety. I prepare surgical trays with sterilized instruments, wear full PPE, and follow strict hand hygiene. I assist the dentist by suctioning effectively, passing instruments aseptically, and monitoring the patient's comfort. I also ensure proper disposal of sharps and biohazard materials. Before the procedure, I confirm consent forms and patient medical history. Post-surgery, I provide aftercare instructions and disinfect all surfaces. Precision, cleanliness, and calm under pressure are crucial when supporting oral surgical procedures. Thanks for watching. If you found this helpful, give it a thumbs up, subscribe for more career tips, and comment below with your dream job. We're here to help you succeed.